Today in international news, a disease is threatening to take over southern and southwestern India. This disease is known as Kashmir forest disease and is quickly spreading through the Karnataka state of India. This disease is caused by a virus and is most commonly spread by hard ticks. Next, we will go to our on-site reporter who will give us more information on this terrifying and threatening disease. I'm standing in the middle of the Kashmir forest of southern India where an outbreak of Kashmir forest disease, or KFD, is taking place. This disease was first discovered in 1957 in monkeys living in this forest. And since then, KFD has been spread across southern and southwestern India. It is most commonly spread through hard ticks. Once infected, ticks are infected for life. They get infected by biting either humans or infected animals. There is an average of 400 to 500 cases of KFD a year with a fatality rate of 3 to 10%. KFD is caused by the Kashmir forest disease virus, which is a member of the Flideridae virus family, and it is an RNA virus that is helical. If you look over there, there's a dead monkey. It is safe to assume that this monkey is infected with KFD. That's why I'm standing so far away from it. Besides getting infected by a tick bite, people can also be infected by having contact with infected monkeys. The red-faced bonnet monkey and the black-faced langur monkey are most commonly associated with KFD. Other mammals such as cows, goats, and sheep can also be infected with KFD. There has been no cases of transmission between human to human and human between cows, sheep, or goats. However, infected monkeys, goats, sheep, and cows can easily transmit KFD to other monkeys, sheep, cows, and goats. Thus, scientists have concluded that the only way humans can be infected by KFD is by contact with an infected monkey or by a bite by an infected tick. The incubation period for KFD is 3 to 8 days, and 10 to 20% of patients have 2 phases of the disease. In the first phase, symptoms include fever, headache, and pain, especially of the upper and lower backs and extremities. Vomiting and abdominal pain also occur in the majority of patients. Hemorrhagic manifestations are also part of the first phase and begin 3 to 5 days after other symptoms. The majority of patients recover after 10 to 14 days with no long-term effects. During the recovery period, patients may present with muscle twitching, tremors, and generalized shaking due to weakness. In the second phase, fever with neurological symptoms lasts for 12 to 14 days. These symptoms include disorientation, drowsiness, dizziness, convulsions, confusion, and loss of consciousness. There is no treatment for KFD except to give fluids and blood or plasma transfusions. Blood or blood products are given because KFD causes low blood pressure, low platelet count, low red blood cell count, and low white blood cell count. Although there is no treatment for KFD, there are several preventative measures that can be taken. First, there is a vaccine. The vaccine requires 2 doses and a booster to be 83% effective. The first 2 doses are given within a month of each other, and the booster is given 6 to 9 months after the first 2 doses. Other preventative measures include using tick repellent to decrease the likelihood of getting bitten and wearing clothes that cover the entire body to reduce the chances of getting bitten by ticks. As you can see, I have on long pants that are tucked into boots, a long sleeve shirt, and a hat. These clothing items reduce the chances of being bitten by ticks. Although there is a vaccine, efforts to vaccinate people in the southern and southwestern parts of India are challenging because there is a low supply of vaccine and many people don't get their second dose or booster of the vaccine. Between the years 2005 and 2010, only 39% of people who were eligible for the vaccine received all 3 doses. 52% of people did not receive any doses. In those same years, 80% of KFD cases occurred in people who were unvaccinated. Thank you. If you are traveling to southern or southwestern India soon, please consider getting the KFD vaccine and make sure to take preventative measures that reduce your chances of being bitten by an infected tick. That's all we have for you today. Stay safe and remember, don't get bitten by ticks. Thank you. Bye.